Hello guys, we are starting with our first session on medical research fundamentals, and today's talk will be about introduction to health research, and starting with acknowledgement, this SMR and NIE. Going on into the session. First of all, what is research? Research is a systematic and organized scientific process to find answers to questions. This question is the basis and starting point of a research. The scientific process will be carried on by certain defined steps and procedures, which we will be seeing in the later sessions of the discussions. And looking on into the dimension of health research, it is all up to the investigator and the need of the investigator. It may be theoretical, and that theoretical researches can be applied to any of the applied researches, what we call as evidence based, and the study can be preventive or therapeutic means, and it may be benchside, that is laboratory studies, to bedside studies, and it may be exploratory or confirmatory studies, or it may be based on some of the health programs which are going to be implemented, or those programs which have to be translational, like from bedside to bedside, how it can be applied. That is also a dimension of the health research. Coming upon to the fundamentals or fundamental principles to be followed, starting upon with the planning stage, which is the very critical stage, and we have to spend enough time and involve right persons in the planning stage. Then comes the teamwork and in review. There are three levels of review, that is scientific review, which is based on the novelty, rationality and justification of why we have to do that study, on that institute or on that place, is the scientific review. Then comes the ethics review. It is purely based upon the human subjects protection, because any of the studies should not keep any human subjects in danger. And regulatory review, that is regarding the foreign funding or some sample shipments which we may be requiring to get from other places, and then the intellectual property or the intellectual input of the investigators and the exchange of visitors has to be looked upon in the regulatory review. The process of health research starts from ensuring the data collected from a systematic manner and drawing meaningful conclusions from it, and drawing some appropriate decisions and making appropriate plans for implementation of those decisions for prevention and control of some diseases, which we call evidence-based actions. And ultimately, this all should help in reduction of the suffering and improve the health and well-being of the community. Looking upon into the breadth and depth of the inquiry of the researchers, it starts from the human host, that may be healthy or susceptible or some diseased persons, or even maybe with death persons. In the means of history taking or tracing out their reports, like that. And then comes the surrounding environment and society, which includes the climatic factors, housing, vectors, animals, sociocultural practices, family structure and all. And comes the healthcare infrastructures, the hospitals, the facilities, the inpatient facilities, and the delivery of the certain national health programs, and so on. Coming upon the uses of research, it starts from getting additional or new info, like for example, whether more diphtheria and pertussis cases are being reported among adults, which was once said to be a pediatric disease. Also similarly, with what are the differences between full genome structure of HBV and HEV viruses. It may be also used for verifying and confirming the available info, like for example, whether the change in the incidence of diabetes and its complications are increased due to the consumption of pre-cooked or packaged foods, and whether the etiology of the pediatric pneumonia differ in less than or equal to 5 aged children in developed and resource limited countries. And the next use comes to be like explaining the cause and effect relationship, for example, whether the presence of specific co-receptor on CD4 cells protect against HIV. Another example being whether the breast carcinoma is more common in breast implants. And then comes, it may be used for testing new drugs, vaccines, tools or interventions for preventive treatment and control of diseases. And example of these are whether INH prophylaxis delay TB in HIV patients, or whether the smokeless stoves cause reduction in the respiratory morbidity and mortality in rural areas. Another one use being evaluating the ongoing programs and assessing the feasibility of new programs. For example, like whether injectable iron sucrose is better alternative for oral iron in pregnancy related anemia because of the already present morning sickness and GI symptoms of the pregnant ladies. And another one thing is whether the IDSP able to predict the epidemic of influenza and bird flu or some kind of recent infections like COVID. And before doing any health research, the making right choice of the study design is very, very important in consuming the time and the economy of the investigator. We have to clearly decide whether it should be a qualitative study or a quantitative study. The qualitative study is mostly observational and it has open-ended questions like involving person-to-person interviews or focused group discussions or free listing, or it is mostly observational. And it may be quantitative study which has a structured questionnaire which will be asked by the investigator, or we have to decide whether it will be an observational study or experimental study. Like in observational study we will not do any change in environment, and in the experimental study we will have to make a change and we'll have to study the effects of that change, or we have to decide whether it is a prospective or retrospective study. Some of as we said earlier, in the planning phase, which is the very critical phase, there are certain critical considerations like adequate justification and conduct of the health research, like in the means of money and manpower. And the research question should have a clarity and focus, like it cannot be a broad ended. And then comes the case definitions of the study variables and outcomes, which should be standard and unambiguous. Like the definitions should be very clear. And then comes the sample and sample size. Like the samples should be representative of that population, because ultimately we will be applying the end or the conclusion of the study to the whole population. And the sample size should be adequate. That is, it should have the power to draw meaningful inferences. And the findings of the study will be then ultimately applied to the community. That is what we have to keep in the mind. And that some of the errors which can be predicted and minimized also has to be predicted during the time of planning phase, so that our study will be significant and will be acceptable by the experts. And under this we can have random error or systematic error. First of all, what is random error? Random error is something like wrong result due to chance, because there may be intra-individual variations, like one human is not the same as the other, so that variations due to chance may cause the random error. And this may be due to unknown source of variation that can distort the findings in either direction. Like it can cause the study result to be positively and negatively influenced. This can be minimized by increasing the sample size and increasing the precision. And systematic error is something which is due to bias, like it may be due to some errors in measurement or in enrolling the participants, or the info is collected. Like this kind of error will distort the results to one direction. This is what we call as bias, and it might be minimized by improving the study designs. So random error is something which is by chance, and we can minimize it by increasing sample size and increasing the precision. And systemic error is something that occurs due to bias, and we can minimize it by improving the study design. Some challenges faced during the research are, for example, confounders. Confounders are those which affect both the study variable and the outcome. And study variable is something a part of the data which we are collecting, and outcome is the result. And the confounders are usually which we cannot exclude them from the study. So the only way is to minimize them by using a proper study design and stratified analysis. And then comes the effect modifiers. Effect modifiers usually alter negatively the result. That is, it has some relationship between the study variable and the outcome. outcome, and it can independently affect the outcome, and it can be minimized by adequate literature review and hence studying them beforehand and excluding them from the study. Now comes the study methods and measurements and issues related to them. Pilot study. Pilot study is like, in simple words, a rehearsal of a study which can be done with a few individuals, and this might help us in knowing or understanding what might be the difficulties which we are facing in the study, and which steps we can take to reduce those difficulties during the study. And then comes the study participants. We have to be very clear in the inclusion and exclusion criteria and recruitment targets, like from where we are taking those samples, whether it is community based or whether it is hospital based, like that. And then comes the data collection and instrumentation, which can't be changed before after starting, so we have to know it before starting. And then comes the measurement tools and assays, which may be the laboratory methods. Before starting a research, we should be knowing what methods we'll be doing, what are the pros and cons of those methods and all. And then comes the planning for statistical analysis, it might help us in focusing on how we should collect the data and how we should reduce the bias during data collection. And then comes the quality control, for example in laboratory methods, which might be helpful in at last validating our results. Then comes the focus on the health research. On the whole, we have to set our mind how this research will help the health of the population to get improved, or how we can predict the occurrence of some diseases in an individual, or various diseases which can be prevented, the ways to prevent them, and effectively curing the disease and decreasing the associated morbidity and mortality. And whether the various societal, community-based or programmatic interventions for disease prevention and control, this all should be the aim of any research which we are taking. We can't do a research just like that, or just for a completion purpose. And the aim of the research, in individual level, it will help to promote the healthy behaviors or prevention or early diagnosis of some disease, and adequate and appropriate treatment of some disease which have already occurred, or some rehabilitation. And at community level, it should help to improve the community behaviors and practices, and prevention and control programs to be implemented, and it should support the affected people in community level and the stigma reduction. And finally, the only thing which have to be in our mind is healthy individual builds healthy nations. Thank you. This is all about the intro of the health research, and our next session will be on how to formulate a research question. Stay tuned till that. All the best. Thank you.